Hi, my name is Dan Navarez. I'm at least 18 years old and I consent to this head to toe assessment.
Hello, can I come in?
Yes.
Hello, my name is Claudia and I'm going to be your nurse today. So today we're going to go ahead and do a quick head to toe assessment and also assess the cranial nerves. Is that okay with you?
Yes.
Alright, and it shouldn't take more than about 20 minutes, okay?
Okay.
So I'm going to go ahead and perform hand hygiene and I would also put on a brand new pair of gloves. So I'm going to go ahead and we're going to start with a series of questions, okay?
Okay.
What is your full name and date of birth?
My name is Dan Navarez. I was born May 16, 1995.
Perfect. And then can you tell me where you are today?
I'm at Chamberlain Hospital.
Do you know why you're here?
I'm here for a checkup.
Perfect. And then what month is it?
It's May.
Perfect. So my patient is alert and oriented ×4. I'm going to go ahead and ask, are you feeling any pain today on a scale of 0 to 10, 0 being no pain, 10 being the worst?
0.
Perfect. And then are you allergic to the environment, any medications, any food?
Nope.
Alright, perfect. So then at this point I would go ahead and do my vital signs. I would take a temperature. I would listen to respirations for a full minute. I would go ahead and put on a pulse ox and take his oxygen level, which we want above 95%. I would take his blood pressure with my blood pressure cuff, and I would take his heart rate. So now I'm going to go ahead and just inspect my patient for general appearance. So my patient is his skin tone has pink undertones. It is appropriate for genetic background. His height and weight are proportional to his body structure. His posture is upright, symmetric, and no obvious signs of deformities. Let's see, he is free of any tattoos or lesions or bumps. He has good hygiene. He is dressed appropriately for the weather, and our interactions are appropriate. Alright, so now let's go ahead and just start. We're going to just start from the head and work our way down, okay?
Okay.
Alright, so first I'm going to start by inspecting the skull, and then it is normocephalic. There's no signs of like masses or bumps or lesions. And then for the hair, it is free of infestation. It's thick and it's silky, not dry or brittle. So then we're going to go ahead and move on to the ears. Just upon inspection, the ears are symmetrical. I'm going to go ahead and take my pen light. We're going to go ahead and look in each ear. Good. Good. So there's no signs of redness or swelling or drainage on both ears. I'm going to go ahead and look behind the ears. And we are just going to check for skin breakdown. So no skin breakdown. I don't see any piercings. And then do you use hearing aids?
Nope.
Okay. Are you exposed to any environmental noises?
Nope.
Alright, and then last thing we're going to do is I'm going to go ahead and just press on the tragus here. Let me know if you feel any pain or tenderness.
Nope. Nope.
Perfect. Alright. We're going to go ahead and move on to the eyes. And then upon inspection, the eyes are symmetrical. Eyebrows are symmetrical. Eyelashes are evenly distributed. And then we see the sclera is white. The conjunctiva is pink. No discharge. And then pupils are round and equal. So now we're going to go ahead. I'm going to take my pen light, okay? Just look at my nose, the tip of my nose here. And then pupils are reactive to light. And then again, just go ahead and peek at my nose and follow the pen light. And then they accommodate. Perfect. We're going to go ahead and move on to the nose. The nose is symmetrical and is proportional to the rest of the face. So I'm going to go ahead and look in your nose. I'm just going to need you to tilt your head up. Okay, so there's no redness, no drainage, no lesions, no sign of deviated septum. So I just need you to cover one nostril and blow, and now do it with the other one. Alright, so nostrils are patent. Perfect. We're moving on to the mouth. So just upon inspection, the lips are nice and moist and pink, not cracked, no cyanosis. I'm gonna go ahead and have you say ah, stick out that tongue. All right. So we have the uvula rises and falls midline. And then we have no signs of bleeding gums. All teeth are intact. Mucous membranes are moist. We have no signs of like lesions. And no halitosis was noted. And then we're going to go ahead and move on down here. So I'm going to go ahead and feel your carotid pulses. Okay. Okay, and they're 2+ bilaterally. I'm going to go ahead and auscultate for a bruit. Okay, so no brewing noted. And trachea is midline. Okay, so next I'm going to go ahead and we're going to move down to respiratory. Just upon inspection, the chest is symmetrical. My patient doesn't have any signs of JVD, labored breathing, or use of accessory muscles. I'm going to go ahead, we're going to listen to breath sounds anteriorly and posteriorly, so front and back. So I'm going to put on my stethoscope 6 different spots and just have you take a deep breath every time I move it, okay?
Okay.
Take a deep breath. Alright, and are you still feeling okay? Not
Yes.
winded or anything?
Nope.
Okay. Just gonna go ahead. Can you turn over? Yeah, there we go. Alright, take a deep breath. Alright, so lung sounds are clear anteriorly and posteriorly. No adventitious lung sounds. Now we're going to go ahead and move on to your heart. So we're going to go ahead and just listen. I'm going to place my stethoscope couple different spots, and this time just breathe normally, okay?
Okay.
Aortic. Aortic. Pulmonic. Verbs. Tricuspid. Mitral. And then apical. And we listen to our apical for 1 full minute. The rate was 72. So rate and rhythm was regular. I didn't S1 and S2 were present. I didn't hear any extra heart sounds, no heart murmurs, no bruise. So now we're just kind of gonna move on. I'm gonna go ahead and inspect your skin. So just upon inspection, my patient doesn't have any tattoos, no redness, no swelling, no lesions, no bruises. And then let's see, I'm gonna go ahead and check for elasticity of the skin and tenting. So I'm gonna go ahead and pinch right here and then pinch right here. So no tenting, which is good, means you're not dehydrated. And then the skin was elastic. I'm gonna go ahead and have you go ahead and go like this with your hands. I'm gonna inspect the nails. So the nails are nice and short, clean, rounded, smooth. And I'm gonna go ahead and if you want to just bring your hands down like this. It says capillary refill. Alright, in less than 2 seconds. Perfect. I'm gonna go ahead and ask you to flip your hands over again. I'm just gonna take your radial pulse. Okay. And so they're 2+ bilaterally, and they match up. So then I'm gonna go ahead and actually have you look down for me. Alright, so we're moving on to the abdomen here. So at this point I would have my patient uncover their tummy, lift their gown up, but for the sake of the video we're gonna leave it on. So just upon inspection, the abdomen is flat to rounded, even pigmentation, no masses, no hernias, no lumps or anything like that. Umbilicus is midline. Now we're gonna go ahead and move on to auscultation. And start on the right lower quadrant. Okay, and bowel sounds are present in all 4 quadrants. Now I'm gonna go ahead and percuss for tympani. Alright, and tympani noted in all 4 quadrants as well. And now I'm gonna go ahead and palpate. So I'm just gonna kind of press on your tummy. Let me know if you feel any tenderness or pain.
Nope. 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 Nope.
Alright, so no pain or tenderness noted, and no guarding or rigidity noted as well. So now I'm gonna go ahead and kind of have you, just stay like that. I'm gonna go ahead and uncover your legs, okay? So I'm gonna go ahead and cover the legs, and I would just take the socks off too. So for the legs, nice and symmetrical. Skin is even pigmentation, pink, warm. Let's see, is there any pain here?
Nope.
Here?
Nope.
Alright, no edema or swelling. And then I'm gonna go ahead and just check for pedal pulses. Okay, and they're +2 bilaterally, and then can you wiggle your toes for me? Perfect. Alright. Now I'm gonna go ahead and I'll have you sit back up for me. We're gonna go ahead and assess muscle strength. Can you squeeze my fingers? Nice and strong. Alright, so I'm gonna go ahead and put your hands out like this. I'm gonna press down, press towards me. Alright, now I'm gonna go ahead and press in. Alright, press out. Alright, perfect. Now we're gonna try the same thing with your legs here. So go ahead and press in with your legs. Alright, press out. Alright, press forward towards me, and then press towards you. Awesome. So my patient has full range of motion and +5 muscle strength. Now I'm gonna have you stand up for me. Take a few steps, please. Alright, and we can see my patient has a nice steady gait. And then if you can just walk for me, heel toe. And this means that my patient has good balance and he passed his Romberg's test. Alright, so now we're almost done. I'll go ahead and have you sit back down. We're gonna assess cranial nerves. So go ahead, close your eyes. I'm gonna put this little thing in front of you. Just let me know what you smell.
Coffee beans.
Alright, perfect. So my patient was able to assess that was coffee. Alright, I'm gonna go ahead and do your eyes. So can you follow the pen line without moving your head, okay? Okay, perfect. And then in, and then out. Alright. And then I'm gonna go ahead and have you cover one of your eyes. Let me know how many fingers I'm holding without moving your head again.
2, 3,
Alright, cover the other eye.
2, 4.
Alright, perfect. I'm gonna stand a couple feet away from you and I want you to read my name tag.
Claudia.
Alright, perfect. I'm gonna go ahead and I need you to cover one of your ears. Alright, I'm gonna say a word. I need you to tell me what it is.
Pizza.
Alright, cover the other ear.
Pasta.
Alright, perfect. Now I need you to shrug up for me. Perfect. I need you to grab your head and tilt it up. Look down, look to the side, look to the side. Alright, awesome. I need you to clench your teeth. I'm gonna feel here. Okay, feel your temporals. Perfect. I'm gonna go ahead and have you smile for me. Puff up your cheeks, and then scrunch up your eyebrows like this. Perfect. Alright, I'm gonna have you say ah, and then move your tongue side to side. Alright, perfect. And I think we are done with our assessment. Alright, is there anything I can get for you? Any water, any blankets? Any questions?
Nope.
Alright, well, it was my pleasure doing this, and thank you.
Thank you.